Medical science has progressed in leaps and bounds over the centuries, with groundbreaking discoveries and innovations revolutionizing healthcare. From the discovery of vaccines to the development of antibiotics, here are 5 of the most significant medical advancements in history and have had a profound impact on human health and longevity. Number 5. Vaccination. The discovery of vaccines stands as one of the most pivotal milestones in medical history, heralding a new era of disease prevention and public health advancement. Rooted in the 18th century, the inception of vaccination can be credited to Edward Jenner's groundbreaking work with the smallpox vaccine. Jenner's ingenious method involved inoculating patients with a weakened strain of the smallpox virus, thereby demonstrating its ability to confer immunity against the deadly disease. This landmark discovery not only revolutionized medical practices but also laid the foundation for the subsequent development of vaccines targeting a myriad of infectious diseases. From the scourge of polio to the devastating impact of measles, mumps, rubella, and influenza, vaccination programs have emerged as formidable defenses against the spread of epidemics. Through widespread immunization initiatives, communities worldwide have been shielded from the ravages of infectious illnesses, saving countless lives and fostering healthier populations. The legacy of vaccines endures as a testament to the power of scientific innovation and collective action in safeguarding public health on a global scale. Number 4. Antibiotics. The discovery of antibiotics in 1928 by Alexander Fleming stands as a watershed moment in medical history, heralding a paradigm shift in the treatment of bacterial infections and marking the dawn of modern medicine. Fleming's accidental observation of the inhibitory effects of Penicillium notatum mold on bacterial growth opened a door to a realm of therapeutic possibilities previously unimaginable. This serendipitous discovery paved the way for a cascade of scientific advancements, leading to the development of numerous other antibiotics including streptomycin, tetracycline, and erythromycin, each with its own spectrum of activity and clinical applications. The impact of antibiotics on human health cannot be overstated, as they have saved innumerable lives by effectively combating once deadly bacterial infections such as pneumonia, tuberculosis, and sepsis. The ability to treat these conditions with relative ease revolutionized medical practice, transforming many formerly fatal illnesses into manageable or curable ones. Antibiotics became indispensable tools in the arsenal of healthcare professionals, providing hope and relief to countless patients worldwide. However, alongside their immense benefits, the overuse and misuse of antibiotics have given rise to a formidable challenge: antibiotic resistance. This phenomenon occurs when bacteria adapt and evolve in response to the selective pressure exerted by antibiotics, rendering these drugs less effective or entirely ineffective against them. Antibiotic-resistant infections present a grave threat to public health, as they can lead to prolonged illness, increased healthcare costs, and in severe cases, death. The emergence of antibiotic-resistant bacteria underscores the urgent need for responsible antibiotic stewardship practices. This entails judicious prescribing of antibiotics, adherence to treatment guidelines, and efforts to minimize unnecessary antibiotic use in both human and animal healthcare settings. Additionally, ongoing research into novel antibiotic compounds, alternative treatment strategies, and innovative approaches to combating antibiotic resistance is essential to safeguarding the efficacy of these life-saving medications for future generations. In conclusion, while the discovery of antibiotics represented a monumental triumph in the fight against bacterial infections, it also brought with it a sobering reality: the looming threat of antibiotic resistance. By embracing responsible antibiotic stewardship and continuing to innovate in the field of infectious diseases, we can strive to preserve the efficacy of antibiotics and ensure that they remain effective weapons in the ongoing battle against bacterial infections. Number 3. Anesthesia. The introduction of anesthesia in the field of surgery marked a watershed moment in medical history, fundamentally transforming the nature of surgical procedures. Prior to its discovery, surgery was characterized by excruciating pain and trauma for patients, often leading to shock and complications. However, in 1846, a significant breakthrough occurred when William Morton successfully administered ether anesthesia during a public demonstration at Massachusetts General Hospital. This groundbreaking event heralded a new era in medicine, where surgical interventions could be performed painlessly and safely. Subsequently, the development of other anesthetic agents such as chloroform and nitrous oxide further expanded the possibilities for pain management in surgery. Anesthesia not only alleviates the physical discomfort associated with surgical procedures, but also facilitates the execution of complex and life-saving interventions. Consequently, patient outcomes have significantly improved and mortality rates have been reduced, underscoring the profound impact of anesthesia on the practice of surgery. Number 2. Theory of disease. In the annals of medical history, few discoveries have been as transformative as the germ theory of disease, a groundbreaking concept pioneered by visionaries like Louis Pasteur and Robert Koch during the 19th century. Before the advent of this theory, prevailing beliefs attributed illnesses to mystical forces or imbalances in bodily fluids, such as the ancient theory of humors. However, Pasteur and Koch boldly overturned these notions by demonstrating that myriad diseases were not manifestations of supernatural wrath or internal imbalances, but rather the sinister work of invisible microorganisms, bacteria, viruses, and other pathogens. Their seminal work laid bare the microscopic culprits behind illnesses that had plagued humanity for centuries, providing a crucial framework upon which modern epidemiology and public health practices would later be built. Through meticulous experimentation and observation, Pasteur and Koch established that these minuscule entities could be transmitted from person to person, igniting a revolution in our understanding of contagion. By identifying the specific microbes responsible for devastating maladies such as cholera, tuberculosis, and influenza, scientists gained vital insights that enabled the development of targeted interventions to combat these scourges. Armed with this knowledge, the arsenal against infectious diseases expanded exponentially. Vaccines were devised to train the body's immune system to recognize and combat pathogens, antibiotics were crafted to directly assail bacterial invaders, and sanitation practices were refined to disrupt the transmission pathways of these invisible assailants. The impact of the germ theory rippled across the globe, transforming the landscape of public health and saving countless lives. It ushered in an era of proactive disease prevention, replacing fear and superstition with evidence-based approaches grounded in scientific inquiry. From the eradication of smallpox to the near elimination of polio, the legacy of Pasteur, Koch, and their contemporaries endures as a testament to the power of human ingenuity in the face of microbial adversity. Number 1. Medical imaging. The evolution of medical imaging technology has brought about a profound revolution in the diagnosis and treatment of diseases. Techniques such as X-rays, CT scans, MRI, and PET scans offer healthcare providers non-invasive means to peer inside the body, revealing intricate structures and processes. These technologies furnish detailed images of organs, tissues, and systems, empowering clinicians with the ability to detect abnormalities early, make precise diagnoses, and tailor treatment strategies to individual patients. Across diverse medical disciplines including radiology, oncology, cardiology, and neurology, the impact of medical imaging is profound. It enables precise tumor localization, evaluation of organ function, and monitoring of disease progression, leading to enhanced patient outcomes and a paradigm shift in healthcare delivery. Conclusion. In conclusion, these 5 medical advancements epitomize major milestones in the annals of medicine, catalyzing a paradigm shift in healthcare and significantly enhancing the quality of life for millions worldwide. From the prophylaxis of infectious maladies via vaccination to the combat against bacterial infections through antibiotics and the introduction of anesthesia to mitigate surgical discomfort, these breakthroughs have not only reshaped medical methodologies but have also been instrumental in preserving innumerable lives. Furthermore, the elucidation of the germ theory of disease has furnished a conceptual framework for comprehending the etiology of illnesses, while the advent of medical imaging has revolutionized both diagnostic and therapeutic modalities. Collectively, these strides underscore the potency of scientific inquiry and innovation in propelling human health and well-being forward. Thanks for watching. Don't forget to like and subscribe to our YouTube channel.